what stage 3 CKD really means. Stage 3, chronic kidney disease. It sounds scary, doesn't it? For many people, hearing that diagnosis feels like a punch in the gut. But let's slow down and really understand what it means. Is it the end of the road? Can you stop it? Can you reverse it? I am going to walk you through everything you need to know about stage 3 CKD juiced, like I do with my patients every single day. Let's start with the basics. Chronic kidney disease means your kidneys are not working perfectly. That could be due to abnormal lab results or findings on imaging. Kidney function is classified into 5 stages from stage 1, which is the mildest, to stage 5, which is the most severe. Stage 3 is the most common stage I see in my practice. In medical terms, stage 3, chronic kidney disease means your estimated filtration rate is between 30 and 59. That number tells us how well your kidneys are filtering waste from your blood. We calculate it based on a blood test called creatinine, then plug it into a formula to get your A normal eGFR is 90 or higher. In stage 3, kidney function drops to roughly 30 to 59% of normal. Understanding eGFR and staging. Now remember, that percentage is just an estimate. It's not perfect, but it helps people visualize how well or not so well the kidneys are working. Think of your eGFR as a percentage. If it's 45, then your kidneys are functioning at around 45% of normal. And here's something important. Not everyone starts at 100%. Your eGFR naturally decreases with age, so a lower number doesn't always mean disease. It depends on the context. But if you're in stage 3, there's definitely something going on that needs attention. Stage 3 CKD is also broken down into 2 substages. Stage 3A eGFR, between 45 and 59. Stage 3B, eGFR between 30 and 44. This breakdown helps doctors better assess risk and track progression. Now, here's the key point. Stage 3 CKD is not kidney failure. You don't need dialysis at this stage, and many people with stage 3 CKD never need dialysis at all. That's why catching it early and acting on it is so powerful. Common causes of stage 3 chronic kidney disease. Let's talk about what causes stage 3 CKD. These are the most common factors I see in my clinic. 1. Diabetes. High blood sugar over time can damage the small blood vessels in your kidneys. That damage reduces their ability to filter waste. This is why controlling your blood sugar through diet, lifestyle, and medication is absolutely essential. 2. High blood pressure. When blood pressure is too high, it puts strain on the delicate filtering units in the kidneys. There is actually some debate about whether high blood pressure causes kidney disease or is a result of it, but either way, managing your blood pressure is critical to slowing kidney damage. 3. Genetic conditions. Things like polycystic kidney disease or Alport syndrome can affect the kidneys, often starting at a young age. These are inherited and need close monitoring. 4. Autoimmune diseases. Conditions like lupus or vasculitis can trigger inflammation in the kidneys and cause progressive damage over time. 5. Medications. Some medicines, especially if taken long-term or in high doses, can be harmful to the kidneys. This includes over-the-counter painkillers like ibuprofen and even certain antibiotics. Real patient stories. Kidney disease can happen to anyone. To help you understand how kidney disease can develop in unexpected ways, let me share 2 real stories from my clinic. Story 1. A woman in her early 60s came to see me. She didn't have diabetes, her blood pressure was normal, but her kidney function was declining, and she was shocked to learn she had stage 3 CKD. The reason: she had been using large amounts of Goodies powder, a non-steroidal anti-inflammatory drug, NSAID, for years to manage back pain. These medications, while helpful short-term, can damage the kidneys over time. We worked together to reduce her NSAID use, adjust her blood pressure meds, and change her diet. Her kidney function stabilized for years after that. Story 2. Another patient, a healthy and active woman, exercised daily and ate a clean, balanced diet. Yet her blood work showed abnormal kidney function. She had no risk factors like diabetes or high blood pressure. It turned out she had a genetic kidney condition. The lesson? Kidney disease can happen to anyone, no matter how healthy you seem on the outside. Can you reverse stage 3 chronic kidney disease? This is one of the most common questions I get. Can stage 3 CKD be reversed? And the answer is, sometimes, but not always. If your kidney function dropped because of dehydration, a temporary illness, or a medication side effect, then yes, it's possible for your eGFR to bounce back once the problem is fixed. But for most people, especially those with long-term conditions like diabetes or high blood pressure, stage 3 CKD is not reversible. However, that doesn't mean you're out of options. What we can do what I focus on with my patients is slowing down the progression of the disease and stabilizing kidney function for as long as possible. That's the real goal. Not reversal, but preservation. So what actually helps slow the progression of stage 3 CKD? 1. Manage your blood pressure. For most people, aiming for a blood pressure below 130/80 is a good target. It might vary depending on your situation, so always talk to your doctor. 2. Control your blood sugar. If you have diabetes, keeping your blood sugar in check is critical for protecting your kidneys. 3. Eat a kidney protective diet. Focus on low sodium, moderate protein, whole food meals. Home-cooked food gives you better control over what you're eating. 4. Avoid kidney-toxic medications and supplements. Overuse of painkillers like ibuprofen and certain herbal supplements can damage your kidneys over time. Be cautious and always ask your doctor before starting anything new. 5. Use the right medications. Some people benefit from SGLT2 inhibitors, ACE inhibitors, or ARBs. These drugs don't work for everyone, but for some, they can slow kidney damage significantly. Your doctor can help decide if they're right for you. Let me tell you about George, one of my patients. When he first came to see me, his eGFR was 42, he had high blood pressure, was overweight, and ate out almost every night. We worked together, he started cooking his meals at home, taking 15-minute walks daily, staying consistent with his medications. 2 years later, his eGFR remained stable. No decline. Now, I want to be clear. Not everyone will have the same result. Even if you follow everything perfectly, your kidney function might still decline. But doing these things gives your kidneys the best fighting chance. And if your kidney function does get worse, despite your efforts, we focus on helping you prepare and plan for the next stage, so nothing takes you by surprise. Before we wrap up, one more thing that's crucial for anyone with stage 3 kidney disease to understand. It's not just about your eGFR number. You also need to know about protein in your urine, specifically albumin. This is called albuminuria, and it's one of the earliest signs of kidney damage. In fact, sometimes it can predict how fast your kidney disease might progress, even better than eGFR alone. Let's take an example. If your eGFR is 55, which is stage 3A, considered mild, but your urine albumin to creatinine ratio is very high, you're still at a higher risk for progression. On the other hand, someone with the same eGFR but normal urine albumin may be at much lower risk. That's why both numbers matter. So, if your doctor hasn't checked your urine albumin, ask them to do it. It gives you a clearer picture of where your kidneys really stand. So, let's bring it all together. Stage 3 chronic kidney disease means your eGFR is between 30 and 59. It's not kidney failure, but it is a wake-up call and opportunity to take action and protect your kidneys from further damage. Here's what you can do. Control your blood pressure. Try to aim for below 130/80ths if appropriate. Manage your blood sugar if you have diabetes. Eat a kidney protective diet, low sodium, moderate protein, lots of whole, unprocessed foods. Avoid kidney-damaging medications and supplements, especially long-term use of NSAIDs like ibuprofen. Talk to your doctor about medications that may help slow progression, like ACE inhibitors, ARBs, or SGLT2 inhibitors. And don't forget to check your urine albumin levels regularly. The good news: most people with stage 3 kidney disease can live full, healthy lives for decades, but only if they're aware of the condition and committed to managing it. If you want to learn more about how food impacts your kidneys, check out my video on 3 foods that may be silently harming your kidneys. Thank you for watching. Don't forget to like, subscribe, and share this with anyone you care about. Leave your questions in the comments. Take care of your kidneys because they take care of you.